Good afternoon, I'm Shane Masters with the Midday News. A special welcome to viewers on onespotmedia.com. The opposition is raising concern about the date change for Jamaica to get its first shipment of COVID-19 vaccines. The Health Ministry on Wednesday announced that the 50,000 doses of vaccine, which were promised by India, will no longer arrive today, but on Monday, March 8. Health Minister Dr. Christopher Tufton had announced that the vaccines would arrive on Thursday, but that date has been pushed back to Monday. Opposition spokesman on health, Dr. Maurice Guy, is calling on the government to give reasons for the hold-up.
The reality is that this setback, and we are hearing Monday, we do not know whether Monday will be Monday of next week or another date will be changed. So that is why I'm saying that it will create some amount of discord among those who are to get it. Secondly,
despite the delay, Dr. Tufton is optimistic that the new timeline to get the vaccines will not be missed.
Their arrival of vaccines came in before the WHO's approval. So they may have accepted at the same time and chose to bring it in before. We, through friendly discussions, accepted after approval. And, I'm sure India's generosity extends to many countries around the world. And it is a gift, as you have said, and they are scheduling issues. And, I don't think a couple of days will make a big difference, to be totally frank. And it will be put to good use when it comes because it gives us time to prepare also.
He also provided an update on the vaccines which are due under the COVAX facility.
So the 14,400 vaccines are in place to be shipped. The only issue around the possibility of delay would be the logistics, the movement of the shipment. Now, I got correspondence today which outlined the route that it would take in terms of the carrier, where it would stop, where it would start, and the expected date of arrival. But as of now, I am very confident that it is there. It is to come. The only delay that could create a challenge is if the movement of it was delayed for whatever reason beyond our control.
Dr. Tufton says that will be for the initial set of vaccines under the COVAX facility. The timeline for the remaining doses, he says, is based upon manufacturing and availability of the vaccines. Now, the health minister also noted that they are expecting to have the 1.8 million doses of vaccine via the African platform in the island by the end of May. However, he noted that other plans are in the pipeline.
Now, I will say, even though we don't give details, that we are discussing other possible options for arrival before that time. But I'm not willing to comment publicly on it until we have a contract in hand and we have higher levels of certainty, because as you can see, this is a very uncertain, imperfect marketplace because of demand issues and supply issues. But I think that we should be able to meet the deadline for end of May for the million or just under a million. And part of that would be the African platform. Part of that would be COVAX. And there are one or two other areas that we're looking into.
Meanwhile, Dr. Tufton has responded to questions about why persons living with pre-existing conditions are not included in the first phase of a government's vaccination plan. The question was raised on Wednesday's edition of TVJ's All Angles. Under Phase 1 of the government's plan, elected representatives and frontline staff, including the elderly population over 65, would receive the vaccine jab first.
The truth is, if you look at the data, and I've looked at it, the 60 to 65% of our comorbid conditions are where there are an issue, where there are issues around how you control it, lies in the population over 60 years. So the truth is that once you go for the over 60s, and it's reflected in the fatalities, by the way, if you look at the deaths from COVID, once you go over 60 years, you are going to be picking up most of the persons who have vulnerabilities.
The minister noted that some 15 to 20% of those individuals with underlying conditions may be missed in the first phase.
You have to find a way, and I think we need to accommodate them don't get me wrong, but I think you have to find a way to structure the approach so it is easy to manage, it is transparent, and you can do so efficiently to pick up the majority, and then at the same time you address the loose ends after. The plan is subject to adjustment. The point that has to be made is that most of those vulnerabilities will be picked up based on age. For those who are not picked up, some are going to be picked up based on frontline workers. For those who are not picked up in that, I think the plan can be adjusted to accommodate them. And so I don't want to give the impression that somehow we're going to, not address persons who are vulnerable based on comorbidities, even though they are young, because that's not the impression we want to create.
Chairman of the Private Sector Vaccine Initiative Oversight Committee, Christopher Zaka, has dismissed claims that arrangements to secure the COVID-19 vaccines are on a preferential basis for members of a private sector organization of Jamaica, PSOJ. Mr. Zaka insists the private sector is merely assisting the government to ensure efficient deployment of the vaccines when distribution commences. Sandy Williams reports.
Under the guidance of the Health Ministry, the private sector is allowed to purchase and import its own supply of COVID-19 vaccines for deployment through the private healthcare network. This as part of efforts to achieve herd immunity against COVID-19 in the shortest possible time. Herd immunity occurs when a large portion of a population is immune to a disease due to vaccination. Medical experts believe herd immunity of 60 to 70% is a crucial bar in curbing the spread of COVID-19. Chairman of the Private Sector Vaccine Initiative Oversight Committee, Christopher Zaka, has denied claims that the private-public partnership arrangements are to secure the vaccines on a preferential basis for members of the Private Sector Organization of Jamaica, PSOJ. Mr. Zaka explained that the PSOJ will be providing logistical assistance, which he believes could be crucial in the efficient deployment of the COVID-19 vaccines across the island, as well as ensure the vaccination process is as smooth as possible.
We have an oversight committee. We have a logistics committee that has already started to work very closely with the ministry to facilitate them. They need, in an urgent way, software. They need tablets to enter data on. They need location, so we're working very closely with them. We have Paris Leoai working with our logistics committee to map out the critical areas of the country where vaccine centers should be, where the sick are, where the aged are. So we're supporting the current phase 1 program, but we do not have any allocation in our plan at this time.
The PSOJ will also assist with the provision of transportation and storage of the vaccines, human resources in areas of the administration of training, marketing and public relations, and the allocation of trained inoculators. Speaking on Radio Jamaica's Beyond the Headlines yesterday, Mr. Zaka gave details on the financial aspect of the arrangements.
We are not expecting to get a return on our contribution. So we're going to buy the vaccines from the NHF. If they say, look, we got 1 million vaccines, we can only manage 800,000 in the next 3 months before they spoil, here is 200,000. Help us to get the tourism workers back on track. We're going to purchase them at the cost, distribute them not through our companies, but through the private pharmaceutical network who will need to have their costs covered for storage and distribution. And that price is what we're going to charge our member firms.
A shipment of 50,000 doses of AstraZeneca vaccine is scheduled to arrive in Jamaica on Monday. Vaccination of Jamaicans is expected to start 48 hours after the arrival of the shipment. Sandy Williams, TVJ News.
Do not be eager to open up your economies. That's the warning from the World Health Organization, WHO, to countries around the world as the fight against the respiratory illness COVID-19 continues. In the meantime, the WHO says personal responsibility is one of the key measures in the fight against the virus. Speaking at a WHO question and answer session on Wednesday, The technical lead for coronavirus response at the World Health Organization, WHO, says globally they are once again recording an increase in COVID-19 cases. It's why they have called for the measures of increased sanitization and mask wearing to once again be enforced globally.
It's really important that everyone out there still adheres to these measures in place because we have quite a ways to go to continue to drive transmission down. It's going to take some time for vaccines and vaccinations to reach all of us, to reach most of us. And while vaccines are being rolled out in many countries around the world, we need to still continue to stay the course and adhere to these measures.
This warning comes just days after the Jamaican government extended the nightly curfews and implemented other measures in a bid to curb the spike in cases that the island has recorded. For the month of February, the country recorded over 7,300 confirmed cases of the virus. It has led to the government also closing a number of places, including gyms and recreational spaces at 6 p.m. to limit social gatherings, a measure which is supported by the World Health Organization.
If we increase our social mixing, if we increase our exposure to the virus, it will take advantage of that and it will increase. And so that's what we're worried about by seeing this 1 week of increase in trends. It's a pretty stern warning to all of us that we need to stay the course and we need to keep adhering to these measures at hand.
Meanwhile, Executive Director of the World Health Organization's Health Emergencies Program, Dr. Mike Ryan, says governments should not be rushing to open their economies, as this will only increase the burden on the country's healthcare system.
But we shouldn't be working to dates. There is no date. The virus doesn't understand dates. What we understand is the number of cases and the number of new cases every day. We should be looking to get that number as low as possible.
341 new COVID-19 cases were recorded across the island yesterday from 1,901 samples. This represents a 17.9% positivity rate. Their ages range from 16 days to 89 years. This pushed the total number of confirmed COVID-19 cases to 24,444. Kingston and St. Andrew recorded the largest number of cases with 154, followed by St. James with 56 and St. Catherine with 41. Meanwhile, one more person has died from the respiratory illness. The total number of COVID-19 related deaths now stand at 436. The latest case is a 97-year-old woman from Kingston and St. Andrew. The Ministry of Health says one other death is being investigated. Now, 275 persons remain in hospital. 27 persons are critically ill. There are currently 9,911 active cases. And it's time for a break here on the Midday News. Stay with us. More stories when we return. Welcome back. Continuing the news. Opposition spokesman on finance, Julian Robinson, says he is concerned that the current budget will not adequately address the economic fallout and the rising inequality caused by COVID-19. Mr. Robinson was speaking during yesterday's sitting of the Standing Finance Committee of Parliament.
There are individuals who have not worked for over a year, small businesses that have survived, but barely. And the persons who have been most affected are those who are in our informal economy. COVID-19 has also exposed the glaring inequalities in our educational system, with a wide disparity between those who can access online education and those who neither have computer, tablets, nor internet connectivity. The opposition believes that the projections made in the current budget will have to be further revised given the continued depression of economic activities caused by measures to contain COVID-19.
And the opposition spokesman on finance is raising concerns about the government's COVID Care Grant program. Mr. Robinson argues that many small businesses in the tourism sector who qualified for assistance under the program have still not received payments.
These were entities that were given commitment letters from the Exim Bank in November of 2020, indicating that disbursements would be made within a week of that letter. Many of these entities committed expenditures based on the letters and have heard nothing since. Is it that the government does not have the funds to fulfill the commitment? If this is the case, then this needs to be communicated. Do not give the businesses the impression that they are being ignored or that they are not a priority. The majority of these businesses went through a very detailed process of submitting their financials, doing an assessment, and since November, they have not been able to get any word as to when these payments are going to be made.
In response, Finance Minister Dr. Nigel Clark said he will address the matter.
Exim Bank provides us with the businesses, and the Ministry of Finance transfers directly to them. So if you can supply me with the names of the persons who have not received, I'll be in touch with the Accountant General to verify, and if that is the case, find out what has gone. But the instructions for the transfer have been given, and the transfers, to the best of my knowledge, have gone out. But
Energy Minister Darrell Vaz says the devaluation of the Jamaican dollar is not to blame for the skyrocketing fuel prices locally. Jamaicans have been hit by 6 weeks of fuel price increases. Last week alone, some motorists were asked to pay $4 more for a litre of petrol. The spike in local oil prices has coincided with the Jamaican dollar trading at more than 150 for $1, and this has sparked concern from the opposition PNP. The Energy Minister was pressed to provide an explanation for the unfavorable oil prices during Wednesday evening's meeting of a Standing Finance Committee of Parliament.
But now that the freeze has unfrozen,
yes.
I was expecting this week, this week to see a price reduction, and also probably you could say what effect devaluation has been having on it.
I inquired about that, and I was told that minimal effect in relation devaluation in relation to the increase in prices.
In news overseas, for the second day in a row, Brazil has reported its highest daily death toll from COVID-19. Almost 2,000 people died on Wednesday, pushing the country's 7-day average to its worst level yet. More from the CNN.
Here in Brazil, more than 1,900 people died from COVID-19 on Wednesday, a new daily record in a country where the total death toll has already surpassed 250,000. The health ministry also registered more than 71,000 new cases, bringing the total number of cases to over 10.7 million and pushing the health system to the limit. ICUs across the country near or at capacity, with 1/3 of state governments reporting ICU occupation at over 90%. The new wave of infections and deaths has been blamed on a more relaxed attitude, with a rash of big parties around carnival time, as well as a more contagious variant. The governor of Brazil's biggest state, Sao Paulo, announced on Wednesday that more restrictive measures, known as the red phase, would be imposed starting this weekend. That means all but essential businesses must close. Governor João Doria warned that the state's health system was on the verge of collapse if drastic measures weren't taken. He joins a growing list of mayors and governors who've imposed tighter measures in the hopes of slowing the spread of the coronavirus. Brazil has vaccinated less than 4% of the population, and the national vaccination program has suffered from repeated delays and political infighting.
News now in sports. Captain Kieran Pollard became only the second man to hit 6 consecutive sixes in an over in T20 internationals to lead the West Indies to a 4-wicket win over Sri Lanka in the first of their 3-match series at the Coolidge Cricket Ground in Antigua last night. Set 132 to win, Pollard smashed 6 sixes off the 6th over, bowled by Akila Dhananjaya to help set up the West Indies' reply of 134 for 6 of 13.1 overs. The Trinidadian joined Yuvraj Singh in taking 36 runs off an over in a T20 international. He eventually blasted 38 from just 11 deliveries before Jason Holder guided the team over the finish line with an unbeaten 29 from 24. Landon Simmons with 26 also got amongst the runs. Dhananjaya had earlier grabbed a hat-trick in the 4th over, taking the wickets of Evan Lewis, 28, as well as Chris Gayle and Nicholas Puran for a duck each. Wanindu Hasaranga ended with 3 for 12, Dhananjaya 3 for 62 for Sri Lanka. Earlier centre bat, the Sri Lankans were restricted to 131 for 9. Obed McCoy took 2 for 25, while there was a wicket each for Jason Holder, Fidel Edwards, Dwayne Bravo, debutant Kevin Sinclair, and Jamaica's Fabian Allen. The second T20 takes place tomorrow at the same venue. And that's the midday news. I'm Shane Masters. Join us at 7 for primetime news. On behalf of the news, sports, and production teams, good afternoon.